Good afternoon, Durham. I'm Rod Jenkins, Director of the Durham County Department of Public Health, here with another update on the ongoing lead assessment at some of our parks. Since June, the City of Durham has been working to assess lead levels in the soil in 5 of Durham's parks. This final soil assessment report is now available on the city's project webpage at dprplaymore.org and has been sent to the North Carolina Department of Environmental Quality for their review. While the city awaits the state's review and direction to possibly remediate and prevent potential future exposure, access to park areas measuring above the EPA threshold for lead have been restricted with fencing, and bilingual signage is present to alert park visitors. Additionally, here at the Health Department, we are working to temporarily offer lead testing to children soon. This will be available to children 6 months to 6 years old, as this is the age range at which lead is likely to have significant health impacts due to children's nervous systems still developing. When more information is available on when and how to get your child tested, we will share a news release and post the information on our website and social media channels. So stay tuned. In the meantime, I'd like to answer a few frequently asked questions we and the state have received about this investigation and about lead in general. First, if your child's test shows high blood lead levels, is this a result of exposure at the park? It is possible, but unlikely. Children are much more likely to be exposed to harmful levels of lead in homes and buildings built before 1978. Most lead exposures at home is due to lead-based paint that is chipped or contaminated dust or soil in or around the home. Second, if your child has lead found in their blood, what happens next? If a child younger than 6 years old is confirmed to have elevated blood levels above 5 micrograms per deciliter, we will offer you an opportunity for a home environmental investigation as well as educational resources. If your child's blood lead level is above 10 micrograms per deciliter, a home lead investigation is required and all hazards must be removed or fixed by the homeowner. Third, have there been childhood lead poisoning cases found in Durham? Yes. Over a 6-year span from 2013 to 2019, before the state stopped reporting this report due to HIPAA restrictions, 111 children were confirmed to have elevated blood lead levels, with 23 of these children at the higher range above 10 micrograms per deciliter. Although this data is unavailable to share the specific sources of each of these exposures, the state continues to emphasize that the vast majority of exposures occur within the home. Next, can you as an adult be tested for lead exposure as well if you played in this park as a child? The effects of lead exposure are only detectable in the blood for a few months, but can be stored in your bones and released into your blood if you break a bone or if you become pregnant. If you are pregnant, prenatal care providers can provide blood lead testing. If you are not pregnant but would like testing, speak to your primary care provider. Finally, what is the health department doing in response to this lead investigation? I have personally met with the state officials from the Department of Public Health and the Department of Environmental Quality to seek their expertise. We have provided educational information about lead to child care centers, and we will have our school health nurses to provide this information to their assigned schools. We have a dedicated website for lead, and as mentioned, we will soon begin temporarily offering lead testing here at the Department of Public Health for children ages 6 months to 6 years of age. We will share details about when and how to get your children tested as soon as more information is available. Perhaps most important to remember, you can always contact your child's primary care provider about testing for children in this age range. If your child is behind on their immunizations, please consider this perfect opportunity to possibly get them tested for lead and also to get them up to date on their immunizations. Your primary care provider can assist you with this, or you can come to the Department of Public Health. For homeowners of pre-1978 homes, we encourage you to consider repairs and remediation that can rid your home of lead-based paint. We will continue to work alongside the city and the state for any needed next steps determined after the state reviews the report and advise on how best to proceed. Please visit dprplaymore.org for more information about the report, maps of the affected areas, and much more. You can also visit our website at decopublichealth.org/lead for general lead safety information. The safety of our community's children is our top priority, and we will continue to work with our city and state partners to provide you with the resources and information you need to keep your family safe. Thank you.